It's more than the diet that you're doing. It's more than going to the gym. It's more than just trying to remove all the phthalates, all the parabens, all the makeup, all shampoos that I spoke about when coming to healing PCOS. In holistic PCOS, when we talk about healing, we talk about a lot of pillars. There are around 8 to 9 pillars. But today I just want to speak about one pillar which a lot of women out there they might be struggling with, or they find themselves even in not being able to come out of it. And this is going to be something very, very important in helping you to reverse your PCOS. What is called trauma. A lot of time, a lot of people, they never even want to touch some of the subjects which they still holding on. The emotion have built up in their gut system, have built in their joints, have built in their brains. So when coming to heal PCOS, you should be asking yourself, what kind of toxins are you dealing with? I know, yes, toxins is toxins, and it's not just only the toxins that I spoke about, the phthalates, the parabens, or the ones coming from your toiletry or makeup or shampoos. Now let's talk about environmental. Out of all these pillars of holistic wellness or integrative, healing methods, I want to speak about the emotional well-being, because cortisol is the main factor when you check a lot of women who are dealing with PCOS is at the highest level when you check magnesium deficiency and all these deficiencies women have. We find that when we look at the prolactins, the testosterone, the follicles, at the high androgens levels, we find that cortisol is at the highest level in most women with PCOS. And the question is that what's causing this? Fine, it can be so many things: lack of sleep, lack of nutrients, and lack of this. But for most of women, some they might not be able to recover, or they are struggling to recover from the trauma they experience at a certain age. It might be a breakup, it might be disappointment, it might be. The question is that as much as you have put all these nutrients and diet and plants and everything you put, the question is that have you recovered? Are you healing emotionally wise? The trauma that you went through, how are you feeling about it? Because if it's gonna keep on coming back and forth, yes, sometimes it takes years for the things to heal. It takes months and years or whatever. However, this is conversation that I want to think deeply with yourself. Like, have you started having a conversation about healing yourself emotionally? Because it's going to connect your gut health and your brain health. And if your emotions are not stable, they are going to jeopardize the chances of you getting to a place where you want to go, especially healing your gut, healing your mental health, because these are the two things that are going to impact your cortisol level. They are going to impact your insulin levels when you're a woman dealing with trauma, or you're dealing with emotional well-being. And it's something that we have to pay attention, because it's like people who can use a glucose monitor to monitor their blood sugar levels. It's not that. It's more than just only monitoring your blood sugar, your glucose monitor levels. It's more than that, because there might be a lack of sleep, and we need to ask ourselves, what is causing you to have a lack of sleep? It might be maybe you are wondering, or you still, same thing I'm talking about, trauma, or you still have not recovered from what have happened from you, or maybe the social environment or the workplace you are working at is not healthy for you, or the relationship you're having with, or whoever you're having with, is not beneficial for your health, is impacting your health. I'm not asking you to go and break up. You can get help. You can get people who can come on platform where they can help you to start analyzing yourself much better. So if you're a woman, that you're struggling with PCOS, the question is that I want you to go and assess your workplace environment, your social environment, your relationship environment. Those three things are going to be very crucial in helping you to understand yourself much better as a woman in reversing your PCOS, because they can impact your cortisol level all the time, or you feel you can't sleep. Because when your cortisol is up, you're always going to struggle with insomnia and anxiety and panic attacks. They are related to each other. I'm not saying cortisol is the only main factor causing you to have all this. Insulin level as well is going to be other things. Your hypothalamus is going to be something in the pituitary glands connected in regulating your hormones to release your periods or to be fertile ovulation. So you need to go and assess those things. If you have not, I suggest now get a coach or let's sit down and start formulating a better plan. How can you move forward in reversing your PCOS? If all these diets, all these supplements, they are just only touching the surface, you might have to go deeper than touching the surface. You might have to go deeper where you have to look at things in a different way, like a coach, where we bring 9 pillars of holistic or integrative healing, where we try to heal your physical, your emotional, your occupational, your environmental, your socially, your money, physically. We have to do all this.